Beckis. I'm so glad you could meet with me today. I understand that you're with the Homeschool Coalition organization, and I wanted to talk to you today about Senate Bill 359. Are you familiar with that legislation?
I am very familiar. You know, I'm part of a group that vetoed this bill.
Well, I do understand that, and first of all, I just want to tell you that I respect what homeschoolers do, and I think that that's a huge dedication in your life to your child's education. I'm a parent myself, and so I can really relate to that, and I completely understand that you have concerns about parental rights when it comes to your children. Okay. Well, if you don't mind, I'd just like to talk to you a little bit about what the legislation means as far as healthcare goes, because I'm also, like I said, I'm a parent, but I'm also an emergency department nurse, and I just want to talk to you about who the focus of this population is. The focus for the population for this Senate bill actually is not children. So what happens in the emergency room is that psychiatric patients are presenting to the emergency room much more than they have in the past because our psychiatric resources across the city are very scarce. Not just across the city, but across the state and across the United States. We just don't have enough psychiatric resources to fulfill the needs of our psychiatric population. So many. I'm not sure if you're familiar with patients who are suicidal, but they don't always say, and they're not always forthcoming with what they're presenting to the emergency room for. They just come and they request help sometimes. And sometimes that's a vague request, and suicidal patients don't always make it known about what their plan is. So follow out with those instructions.
Do you feel like the physicians are being given too many rights now?
Well, as an emergency department nurse, I can understand, and I'm an advocate for patients, so I understand patient rights. But at the same time, I also understand that some of the patients that we see aren't very capable of making medical decisions when they're suffering with mental illness. So now what it is, it's an order from the physician that allows the hospital to hold that patient, and it's temporary. It's only for up to 4 hours. After that time frame or during that time frame, the physician would be continuing to evaluate the patient and may find that the patient either stabilizes or does indeed need an emergency detention warrant from a judge. I'll just give you I'll give you a personal example from my experience. Several years ago, I worked at a hospital where we had a psychiatric patient that wanted to leave, and as nurses, we feel like we're put in these ethical situations where they're really gray areas. You know, I'm a patient advocate, so I feel like if a patient's not safe, I need to do everything I can to keep the patient safe. Even this patient in particular was at high risk. He had had suicidal attempts in the past, and he was actually there because he had tried to commit suicide earlier that day.
Oh, wow.
But in the middle of his treatment plan, he told us that he was no longer suicidal and needed to go do some things, so he wanted to leave. This patient left, and then a few hours later was unfortunately brought back into the emergency department in cardiac arrest because he did, in fact, successfully commit suicide.
Oh my, that was a terrible event.
Thank you. And I think, you know, just because this legislation was vetoed doesn't mean that it was unsuccessful. I think what will happen now is that we'll be able to do more education about what the psychiatric crisis really is here in the community. I know that a lot of the psychiatric organizations such as Mental Health America and the National Alliance of Mental Illness, they supported this legislation, and they are mental health advocates. Wow. So that says a lot about how powerful this legislation is. And just because it was vetoed doesn't mean that we can't learn more about it. And sometimes things need to go through the legislature a few times before we're successful. And if there are any edits that we need to make parents feel more comfortable with their parental rights, I'd be happy to assist your organization with that as well.
Would you be willing to come and speak to our organization?
I would. Anytime.
Okay, well, we'll definitely invite you.
All right.
I appreciate your time.